In healthcare, shock is a state of cellular and tissue hypoxia due to either reduced oxygen delivery, increased oxygen consumption, inadequate oxygen utilization. It is a plumbing failure where the vital organs don't get the blood they need to survive. Here is with the quality capsule. Let's break down the 4 main types of shock. And here, regardless of the type, the end result is the same: hypoperfusion. However, the way you treat them is vastly different. So let's start by hypovolemic shock, the low tank. The problem here is that there is not enough fluid in the pipes. Causes can be hemorrhage, trauma, GI bleed, or non-hemorrhagic fluid loss like in severe vomiting, diarrhea, or burn. Your classic sign will be tachycardia, hypotension, pale, cold skin, and the low urine output. And the treatment, of course, is fill the tank, IV crystalloids, normal saline, or lactate ringers, or you can use blood products. Moving to cardiogenic shock, the broken pump. The problem here is that the heart is physically unable to pump the blood that is available. Causes can be myocardial infarction, MI, arrhythmias, or end-stage heart failure. Cause signs will be hypotension with pulmonary edema, crackles, cold clammy skin, and increased CVP, central venous pressure. Treatment is fixing the pipes, entropics, dopamine, diuretics to reduce the preload, and potentially mechanical support, IAPP or Impella. Quality alert here: avoid aggressive fluid pulses. You could flood the lung also. Moving to septic shock, the leaky large pipes. Here the problem is part of a disruptive shock family. Massive vasodilation makes the pipes too big, and capillary leaks make them leaky. Causes systematic infection, sepsis, of course. You have classic signs: early warning phases, flushed warm skin, and high cardiac output. Late phases, you have a cool skin and hypotension. Treatment: plug the leak and shrink the pipes. IV boluses 30 ml per kg, vasopressor sprint, norepinephrine is the first line, and lastly, early antibiotic within the first hour of the shock is the main treatment for you. Lastly, we have obstructive shock, the broken path. The problem here is a physical obstruction prevents the blood from flowing into or out of the heart. Causes can be cardiac tamponade, tension pneumothorax, or massive pulmonary embolus, BE. Classic signs: distended neck vein, GDA, and pulseless paradox. Treatment include remove the block, need decompensation, pneumo, or precardiocentesis, tamponade, or thrombolytics, PE. Professional nursing tip here: the map is alive. Your goal in almost all shock were aim for MAP, mean arterial pressure, more than 65 to ensure that the kidney and the brain are being perfused. Lactate acid level tells you that the cells are striving for oxygen and switching to anaerobic metabolism. If the lactate is dropping, your treatment is working. And of course, the golden hour, especially in sepsis, the speed of antibiotic and fluid administration is the first predictor of survival. The bottom line here is that identify the cause to determine the cure. Hypovolemic needs fluids, cardiogenic needs support, septics need vasopressor and antibiotic, and obstructives needs the pressure release. Thank you. I will see you in a next quality capsule.